The news with no bias and exception.
The news for truth and accuracy.
This is the channel for media and information operatives, C.N.L, M.I.O. Good day, this is Eliana Ramal.
And I'm Christine Joyce Lopez, and for today's headlines, Ilocos Norte jeepney drivers were given a healthcare plan and gas allowance. An update for the COVID cases in Ilocos Norte, and for our sports fan, Ilocos Norte holds beach volleyball workshops for local players and officials. Joe Biden allowed vaccinated Americans to walk around the public even without a mask.
Kapamilya actress Angel Locsin bashed after an elderly died in her community pantry. The World Health Organization advises that ivermectin should only be used to treat COVID-19 within clinical trials. India faces an enormous strain after a massive surge in COVID-19 infections, and many more. Ilocos Norte jeepney drivers to get healthcare plan and gas allowance. Here is Christy Balion for the news report.
In support of jeepney drivers affected by the limited movement of people during COVID-19 pandemic, the Ilocos Norte government, through its Sangguniang Panlalawigan, will be setting aside a certain budget to cover their medical insurance and gasoline allowance to ease their financial difficulty. Dubbed as Pantawid Pasada Program, each beneficiary will be given a health and medical insurance card as well as gas voucher valid for 1 year. In addition, the card bearer will get an 8 to 10% discount to purchase at partner drugstore located in the province. Previously, around 1,000 jeepney drivers in the province were given a fuel subsidy and cash forward program courtesy of the provincial government. The program was implemented by allowing the jeepney drivers to provide free rides to frontline workers in various parts of the province with a daily wage of 340 pesos and gas subsidy. Since the start of free ride program, over 10,000 frontliners and 317 patients have so far availed of the program. Attorney Nikki Pilar, Administrative Officer 5 of the Metro Ilocos Norte Council, said Friday, the government was developed to protect the target beneficiaries who are at risk every day of their type of work. Pilar said the Ilocos Norte government allotted a total of 20 million pesos for the project. This was assured by Governor Matthew Joseph Manotoc on Friday following his meeting by the Jeepney Operators and Drivers Association at the Lawag Centennial Arena. During the meeting, Manotoc expressed gratitude to the drivers and operators of jeepneys who are flying at least 25 routes in the entire province. For truth and accuracy, this is your broadcast operative Christy Balion for C.N.L. M.I.O.
Thank you so much for that wonderful news, Christy. And now for an update on the COVID cases here in Ilocos Norte. Our province has endured a spike and increase of the number of COVID-19 cases for the past few weeks. As of the 30th of April, the provincial government has released an update regarding our current situation. Based on the update, it has been recorded that there are 25 new cases and the death of INC 1690 leads to a total of 524 cases and 15 total deaths. The provincial government of Ilocos Norte intensifies all efforts in preventing the virus from spreading. This is by implementing localized lockdowns. While municipality of Dingras, which have been the center of virus containment, is still under the localized Modified Enhanced Community Quarantine or the MECQ. Also, as part of the intensive efforts, the provincial government has been conducting a more aggressive contact tracing and containment, thus isolating patients even before subjecting them to confirmatory tests. This pandemic is far from over, as government officials have urged that all organizations must tighten and strengthen their COVID protocols, we remind everyone to continue practicing minimum health standards and take personal precautions to protect ourselves and our families.
And with the additional report of 8,929 more people infected, Philippines records more than 1 million COVID-19 cases. We've got our reporter Robin on the case to let us in some of the details. Robin?
Philippines have accumulated over 1 million confirmed cases of COVID-19 as of April 26, whereby debates arise about the easing of quarantine restrictions in line with the reopening of the economy or not. 1,006,428 cases have been recorded as 9,000 new cases were added to the nation's total on the 26th of April, with 16,853 deaths and only 2% of which have recovered. Seen from another perspective, 1% of the population as of 2015 have been infected, where it translates to 1 confirmed case per 100 people. The initial 250,000 cases were confirmed in the first 7.5 months since the 30th of January, as the first case was a woman from Wuhan where the virus originated. The second, 250,000, only took 4 months more, while the third and fourth took 2.5 and less than a month respectively, with Philippines being second to Indonesia with 1.6 million cases in the entire Southeast Asia. The economy has come to be the talk among the authorities. According to data crunchers, the number of cases in Metro Manila, where nearly half of the infections were reported, is declining as a result of the tight quarantine restrictions in place since mid-March. They cautioned, however, that it was still too early to further liberalize the economy. The trend is unstable in that it has not been sustained over a long period yet, said Professor Guido David, a spokesman of the University of the Philippines-based Octa Research Group. From March 29 to April 10, Philippines put Metro Manila and 4 neighboring provinces, home to a quarter of the country's population, under strict lockdown as attempts to contain fast-spreading coronavirus failed. Many patients died of COVID-19 before being wheeled into an emergency department due to hospital overcrowding. Some died in hospital parking lots where tents had been set up, and at least 1 person died while attempting to self-quarantine inside his vehicle. President Rodrigo Duterte on Wednesday approved the extension of the second strictest quarantine level in Metro Manila and nearby Bulacan, Cavite, Laguna, and Rizal provinces. Duterte said the NCR Plus area will stay under MECQ until May 14 and also placed Santiago City, Quirino, and Abra province under MECQ. The following areas would be under general community quarantine: Apayao, Baguio City, Benguet, Ifugao, Kalinga, Mountain Province, Cagayan, Isabela, Nueva Vizcaya, Batangas, Quezon, Tacloban, Iligan, Davao City, and Lanao del Sur. With that said, the rest of the country is under the loosest modified GCQ. For truth and accuracy, this is your broadcast operative, Robin Lazo, for C.N.L. M.I.O.
While it may be difficult, we must try our best to keep our distance to avoid the risks and be safe. Right, Christine?
Yes, I think it's very important that we must do this so that we could avoid any more danger, and also we could finally go back to how life was before.
For our sports news, Ilocos Norte holds beach volleyball workshop for local players and officials. Here's Rian Mata for the news report.
On the 24th and 25th of April, the second year of the annual Angelo Marcos Barbell Beach Volleyball Clinic was held at Beachfront Playa Tropical, Curimao, Ilocos Norte. The tournament was guided by the Union of the Officials of the 2nd District Municipalities, officials of the City of Batac, and Congressman Angelo Marcos Barba himself. According to Mr. Barba, the tournament will significantly contribute to the promotion of the Ilocos Norte sports tourism. He also added that it will serve as an avenue to encourage the youth to be more active in sports and to have a healthier lifestyle. UAAP volleyball superstar and Philippine National Volleyball Federation board member Ms. Charo Soriano witnessed and was all praises in the successful event last week. She said in an interview that she appreciates the resiliency of the North in making sure that they not only focus in the growth of the players but also in the growth of the technical officials. This event was the first time a beach volleyball seminar took place in the province under the Play Safe program approved by Governor Matthew Marcos Manotoc, stated by Ms. Helen Domingo, Ilocos Norte Volleyball Secretary General. For truth and accuracy, this is your broadcast operative Rian Mata for C.N.L, M.I.O.
As the Philippines continues to impose lockdowns, community pantries arises for the Filipinos. Here's Catherine for the news report. Catherine?
The community pantry idea became a movement after a young woman named Ana Patricia Non had set up a small stall with canned goods, fresh vegetables, vitamins, face masks, and other necessities on Maginhawa Street on the 14th of April, offering free food to anyone with one request: take what you need and give what you can. This movement had gone viral around the archipelago and the initiative exploded as helped by the wide coverage of social media. The Maginhawa Community Pantry started with 10 visitors a day with only Non doing the work. Now it has dozens of volunteers helping Non, serving an estimate of 2,000 families each day. Community pantries are now scattered around Metro Manila, eventually reaching as far as Iligan City in the far southern region of Mindanao. Concerned citizens are bringing their efforts together in this movement. Non, the instant community superwoman, shares that donations have been pouring in from a lot of people, from restaurant owners, well-off anonymous supporters, and even those from low-income backgrounds. And the same goes for the 350 and counting pantries following Non's lead. The country is infamous for imposing the world's longest lockdown. It has inevitably hurt the economy and the most vulnerable. In February, some 4.2 million Filipinos were unemployed, according to the government data, which also predicted that up to 17.5% of the country's 110 million people will remain poor this year. Towards the end of March, the administration of President Rodrigo Duterte reinstated tighter quarantine protocols, but promised a relief check of around $20 to 22.9 million impoverished Filipinos. With the people struggling during the pandemic, little to no financial assistance and aid have been afforded to the country's poorest. And as these pantries appear, it's no wonder why the queues were long enough to encircle entire street blocks. Efforts like this give us hope that we can come together and help each other out. I felt that the state response was not enough. They're doing something, but it isn't enough. People wouldn't be lining up at the pantries if the help was sufficient, says Non. She illustrates, this initiative does not discriminate against gender, class, affiliation, religion, or anything else. It's just based on our capacity to help. There is freedom in that. The community pantry is an idea whose time has come. It is an idea that has made us proud to be Filipino. For truth and accuracy, this is your broadcast operative, Aliana Ramal for C.N.L M.I.O. Actress Angel Maxine bashed after an elderly died in her community pantry. We have our reporter, Precious Jewel, on the case.
Kapamilya actress Angel Maxine, known for her role Rian from the hit TV show General's Daughter and Monica from The Legal Wife, has received criticism after an elderly man died at community pantry she has helped set up. Loxin marked her 36th birthday by hosting a community pantry in Quezon City on the 23rd of April. She put up a community pantry to honor Filipinos who have organized community pantries nationwide to provide free food to those suffering from economic impact of COVID-19 pandemic. Hundreds of people showed up at the actress pantry. While it was initially elderly at first, it later turned out to be a social distancing challenge because of the huge crowd. And one of the people in the line in this community pantry is a 67-year-old balut vendor, Rolando de la Cruz. Based on the witnesses, Mr. de la Cruz lost consciousness while waiting for his turn to receive some goods that are being given away. He was rushed to a nearby hospital but later died due to natural causes. Actress Angel Maxine later apologized several times for the incidents, both in her social media accounts and in interviews. Ang nangyari po ay akin pong pagkakamali. Sana po ay huwag madama yung ibang community pantries na maganda po ang nangyari. said the actress in an Instagram post. I asked for forgiveness from the family, Locsin said on Facebook in Filipino. A while ago, I went to them and talked personally with the children in the hospital. And for the rest of my life, I will ask for forgiveness for them. As of now, I will prioritize helping the family and I will make it responsibility to help them get through this. I am very, very sorry, she said. Locsin said she hoped that the other community pantries set up to help the poor put food on their tables would not be dragged into the issue. Both the actress and the Quezon City government have offered to shoulder burial expenses for De La Cruz. Locsin said it will be her first and last venture after a senior citizen who lined up for hours collapsed and died. For truth and accuracy, this is your broadcast operative, Precious Jawaranga for C.N.L. M.I.O.
For some international news, India's healthcare system is in enormous strain as it set a new global record for a rise in daily coronavirus cases for 5 straight days, while deaths from the infection also jumped by an all-time high. Here's Catherine for the news report.
A month after the Sputnik V vaccine reached India, many people assume that the struggle from this pandemic is over and that wearing a mask or following health protocols is no longer needed, which is why some started going out without wearing a face mask and going to gatherings and such. And at that point, the virus has changed into more lethal and dangerous variants without them knowing it. In an interview with Guata Menon, a health expert talks about the skyrocketing infections and what needs to be done to bring the situation back under control. The negligence on the part of the people and officials had led to everyone letting their guards down. Possible reinfection because of loss of antibodies and new variants have all possible contributed to the surge, said by the health expert Guata Menon. A new variant of COVID-19 is reportedly found in India that caused millions of deaths and pleas of people living in the said country. Their pleas for medical supplies and equipment have been heard, but it's a little bit too late. The surge has been happening now in their country, and 2 of our fellow Filipinos died because of this new variant of COVID-19. The double mutant variant, also known as B1617, is first detected in Maharashtra state. The new COVID infection is reaching high record levels, and the healthcare system is being stretched to its breaking point. India recorded the world's ever daily tally of 314 and 835 new COVID-19 infections on April 22. Now, the South Asian nation total cases are now at 15.93 million and the death arose by 2,104 over the past 24 hours to reach 184,657 based on the Health Ministry data. While we may not know how this event will play out, the only thing that we can do right now is to pray from the people of India. And let's be more careful and follow the health protocols to ensure our safety. For truth and accuracy, this is your broadcast operative Catherine Joyce Banyaga for C.N.L. M.I.O.
AstraZeneca's vaccine has been approved for use in over 20 countries, but still waits for the approval to be used in United States. We've got our reporter Anne is in the case. Anne?
AstraZeneca COVID-19 vaccine, codenamed AZD1222 and sold under the brand names Covishield and Vaxzevria, among others, is a viral vector vaccine for the prevention of COVID-19. Now, AstraZeneca's vaccine has been approved for use in United Kingdom and several European Union countries since December. However, it has not yet been approved in the US because the Food and Drug Administration asked the company to provide results from a large-scale trial, Umar Irfan reports for Vox. Experts have expected the data to show that the vaccine is safe and effective, but worry how AstraZeneca's recent hurdles might impact their reputation around the world. I think the way that the ship will be righted is by having the FDA's scrutiny. I also expect the vaccine will be approved when the FDA is able to review the raw data said by Evans Stefan, a biostatistician in London. More than 20 countries suspended the use of the vaccine while the EMA reviewed the cases, journalists Kai Coppersmith and Gretchen Vogel reported for Science magazine. Most countries resumed vaccine use after the EMA concluded that it is safe. Norway extended its suspension of the vaccine until the 15th of April. Gladys Fauci entered the Solvik report for Reuters. Norwegian officials hope more data about the cause of the blood clots will become available soon. And on March 22, AstraZeneca released its initial results of phase 3 trial, which showed slightly higher effectiveness at preventing COVID-19 than the latest results. The FDA asked the company to conduct a large trial in order to get clearer data than they gathered in their first rounds of testing. In the first trials in the UK, some participants unexpectedly received half doses of the first shot in the vaccine, and the early trials did not include enough people older than 65, reports the Washington Post. And by the morning of 23rd of March, officials of the National Institute of Allergy and Infectious Diseases released a letter from its Data and Safety Monitoring Board that's been examining the AstraZeneca trial. Andrew Joseph reports for Stat News. The letter stated that the AstraZeneca and used outdated data to reach its efficacy number. The move was unprecedented. Usually monitoring boards keep the correspondence with companies private. The AstraZeneca vaccine may not have a large role in vaccinating people in the United States because the 3 companies already approved to supply vaccines in the country agreed to provide enough doses for anyone who wants one this year. But AstraZeneca is participating in the COVAX program to provide doses to low and middle-income countries for no profit. And FDA approval is a global gold standard for safety of medication. At the end of the day, the FDA looks at the data, not the press releases, says the FDA's former chief scientist Jesse Goodman to Vox. Looking at the data and doing their own analysis, it's what's going to determine whether this vaccine gets on emergency use authorization, whether the benefits outweigh the risk. Reports for truth and accuracy. This is your broadcast operative, Hannah Shane Baligut for C.N.L. M.I.O.
World Health Organization advises that ivermectin only be used to treat COVID-19 within clinical traits. On March 31, 2021, the current evidence on use of ivermectin to treat COVID-19 patients is inclusive. This recommendation, which applies to patients with COVID-19 of any disease severity, is now part of World Health Organization's guidelines on COVID-19 treatments. A guideline development group was convened in response to the increased international attention on ivermectin. As a potential treatment for COVID-19, this group is an independent international panel of experts, which includes clinical care experts in multiple specialties and also include ethicists and patient partners. The group reviewed poll by the data from 16 randomized controlled trials, including both inpatients and outpatients with COVID-19. They determined that the evidence on whether ivermectin reduced mortality, need for mechanical ventilation, need for hospital admission, and time to clinical improvement in COVID-19 is very low, certainly due to the small sizes and methodological limitations of available trial data, including small numbers of events. The panel did not look at the use of ivermectin to prevent COVID-19, which is outside of the scope of the current guidelines. The FDA approved that drug ivermectin inhibits the replication of SARS-CoV-19-2 in vitro, although several clinical trials are now underway to test possible therapies. The worldwide response to the COVID-19 outbreak has been largely limited for monitoring or containment. We report that here ivermectin, an FDA-approved antiparasitic previously shown to have broad-spectrum antiviral activity in vitro, with a single addition to Vero H. Islam cells number 2H post-infection with SARS-CoV-2 able to affect 5,000-fold reduction in viral RNA at 48 hours. Apparently, Philippines to start clinical trials on ivermectin other drugs for COVID-19. And this was published April 20, 2021, 1:20 p.m. on SGT. From the source of Facebook on Twitter, Manila Reuters, the Philippines will begin clinical trials of several drugs, including the anti-parasite medication of ivermectin, in patients with COVID-19 to determine their efficacy in combating the coronavirus, a senior government official said. Some politicians in the Philippines have started promoting the use of ivermectin for the coronavirus and giving out free doses, although the country's food and drugs regulator has cautions against its use because of lack of evidence supporting the use of drugs as a treatment. The Southeast Asian nation, which is facing one of the worst coronavirus outbreaks in Asia, is battling a renewed surge in infections, with its vaccination drive reaching only 1.3 million people out of a population of more than 108 million ivermectin tablets have been approved for treating some worm infestations and more veterinary use in animals for parasites. The World Health Organization last month cautioned against using ivermectin in patients with COVID-19 except for clinical trials because of the lack of data demonstrating its benefits. The government will also start trials on herbal supplement derived from the native tawa-tawa plant which can fight dengue, he said, adding to ongoing tests using virgin coconut oil for severe COVID-19 patients. We are trying several medications. They may not be vaccines, but they could potentially speed up for recovery, Mr. De La Peña said. The Philippines has recorded more than 945,000 COVID-19 cases and over 16,000 deaths, the second higher number in Southeast Asia after Indonesia.
And finally, vaccinated Americans are now allowed to walk around maskless as ordered by US President Joe Biden. Here is our reporter, Gabrielle.
Starting on the 28th of April, US President Joe Biden has finally allowed vaccinated Americans to walk around maskless outdoors. In a public interview with President Joe Biden, he has finally announced that people are now able to step out of their own homes without needing a mask, as long as you are fully vaccinated and not in crowded places to avoid any kind of risk.
Starting today, if you're fully vaccinated and you're outdoors and not in a big crowd, you no longer need to wear a mask. I want to be absolutely clear. If you're in a crowd, like a stadium or at a conference or a concert, you still need to wear a mask, even if you're outside. But beginning today, gathering with a group of friends in a park, going for a picnic, as long as you are vaccinated and outdoors, you can do it without a mask.
These recent announcements not only let people against face masks walk in public, but it also motivates unvaccinated people to go take the vaccine shot. Now we are getting closer and closer to returning back to our lives before the pandemic happened. Well, the Americans are getting closer and closer. And while some are still mixed about this recent news because of the unsureness of their safety, President Joe Biden is confident that this new practice will work. Ever since he took office on January 20, the COVID cases have had a stunning progress, in which 215 vaccine shots were administered, and other cases and deaths had gone down drastically. Now there is an 80% drop in deaths and 70% drop in hospitalization. Once 2/3 of the elderly people were fully vaccinated, based on the given report data. And I've actually interviewed a US citizen to know their opinions on the matter. And here's what they've got to say.
I definitely agree with Joe Biden's recent announcement, as it was one, cleared by the CDC, and two, I trust our president, as he has proven that he is competent at his job, and he knows what he's doing.
And while we may not know what will happen in the future, things are finally looking up in the US, and society is now getting back to what it once were.
It must feel great to be walking around in public without having to wear masks, right, Christine?
Indeed, Alana, I would love to experience that again. And that is all for today's news. Again, this is Christine Joyce Lopez, your courier patroness, reminding everyone to please stay safe and wear a mask.
And I am Aliana Ramal.
And this is the channel for media and information operatives, C.N.L. M.I.O.